All right, everybody, welcome to another episode of the Holistic Hub podcast. I'm your host, Dr. Steph, and every episode I bring on a new individual that I just look up to, and I'm so excited to be able to bring on the podcast because they usually specialize in different techniques and things to help support you on your chronic illness journey. And today I'm joined by Dr. Csilla Veress at TrueNorth Health Center. Thank you so much for joining.
Oh, this is a privilege to be here. So I'm so excited. So excited.
So excited to interview you. So Csilla and I actually go way back because I actually worked at TrueNorth Health Center, which is a world-renowned water fasting center up in Santa Rosa, California. So that's where we got to meet and became great friends and just got to work together. And I got to see the amazing healing effects that she had with all of her patients there. So I am excited to dive into prolonged water fasting, the benefits of it. But I want to first start with asking you, what got you started in all this?
So in college, I was pre-med and I was going down the conventional medical route. And thankfully, they recommend you volunteering at a hospital. So I did. And I just had such a different vision of health and medicine when I was starting this journey. And so I saw probably more sickness. I saw doctors, nurses, they were not happy. And I saw kind of the dark side of it. And of course there was, people that were lives that were being saved and all that. But overall, it was not the direction I wanted to take. So I took the next most logical, avenue, and I went into marketing and advertising in Manhattan. And, through that time, I kind of started to find my way. I did Pilates, I did yoga, I found nutrition. I did this nutritional course, which actually introduced me into, dairy might be inflammatory. Like, do you know about gluten? Do you know about toxins? Do you know about pesticides? And so it really started to get that education rolling for me. I definitely did hit a roadblock where I just was burning the candle at both ends because I was miserable. I was working and I was so unhappy. So I was going out, I was drinking, and then I was waking up and doing it all over again. And I lost my soul, like basically. And so when I got out of that field, I started to search for what I really wanted because it kind of brought me back to health. And I don't remember exactly the Google search, to be honest with you, but it was something about social consciousness. Like I was really believing that I'm like, I just want to change the world. And I know that sounds so cliche, but that's what I was thinking is like, I want to be a force in this world. And then wouldn't you know it, my medical school came up, which is Bastyr University in Washington, and it just so resonated with me. I went, I interviewed, I looked at the campus, and I knew that was what I wanted to do. Fast forward in school, Dr. Goldhammer came and talked, and he spoke about water fasting. And if you've ever been somewhere or heard somebody speak and it just resonated into every cell in your body, you're like, that is a truth. Like that, everything he was saying, I was like, I totally believe in that. But I was doing a triple track, meaning I was getting my Oriental medical degree, I was getting my acupuncture degree, and I was getting my naturopathic medical degree. So I just didn't have time to internship. And it was serendipitous because at that time, I was going to go do cancer kind of work and residency on the East Coast. But then my husband at that time got a job at Calistoga. And if you know anything about Santa Rosa, California, Calistoga, California is like maybe 20 minutes away. And so the residency director just kind of said, hey, something opened up at TrueNorth. Does anybody want to come and interview? And at that time, it just all of a sudden everything was moving so fast. I came for a week, I interviewed, and I loved it. And it resonated so deeply with exactly like how I wanted to help people, heal in their lives. So that's kind of like the short version of how it happened.
Oh, no, I love it. It's my favorite part is hearing what kind of got people started. And I know you mentioned that it sounds cliche about wanting to change the world, but I know I feel like that's just something that I find with each person that I've interviewed so far, is that they just had this deep innate calling to wanting to do something to really make a difference. And it's really special when I get to hear people share their story. So thank you for sharing that.
Yeah. Well, you know what? I'll say one thing on that, just because I walked the Camino de Santiago just recently. And that's just a walk across Spain. It's so amazing, spiritual. The one thing that came to me, and it's so interesting because saying I want to change the world is kind of, there's a cliche to it. But I will say what came to me, and I do think that this is an important message, and this is what I want to keep talking about, is that I believe that we're kind of like the human body. Every single one of us souls on this earth is like the human body, in terms of like we have trillions of cells in the human body. If we can move forward and like heal even one of those souls, right? Like, or we can help one of those souls heal and move forward. It's almost like healing a part of the body. And we're so unique, right? Like, I mean, the lung, you don't want it to do the same thing that the heart does, or the heart, you don't want this, like everybody has this unique kind of being in this world. And so we have a purpose, but if we can keep that healing, right? Heal one part and then another part, we do create this amazing, I think, butterfly effect where I think healed people heal people. And I do think we can actually, like, as crazy as it sounds, like you can heal the world. Like we can make this small impact forward, like what you're doing and probably what everybody who's coming on this podcast can do. And it came, like, it was like a vision when I was walking the Camino. I'm like, that's what I mean when I say I want to heal the world. It's like healing by these smaller pieces moving forward, so
Oh my gosh, absolutely. That was amazing to share.
Yeah.
Thank you so much. And I love that you got to go on that trip and kind of have that profound realization, in a sense too, something that you probably always felt, but it actually came to you.
Yeah,
Yes,
totally.
Exactly.
Yeah.
Oh, well, I am so excited to get into discussing what it is that you do on a regular basis. And prolonged water fasting is so beautiful because it's almost like a forgotten art. It's something that we as humans have evolved doing for centuries. And so I would really love to talk about it because it's really tapping into our body's innate healing mechanisms. So let's go ahead and just dive right into prolonged water fasting and what are we seeing physiologically happening with prolonged water fasting?
So with prolonged water fasting, I usually break it down into three main categories to help people visualize what's going on physiologically and also understand the benefits of it. And why would you even do it if it's safe for you to do? Number one is, this is talked about all over the place, so I'm just going to start there, and that's ketosis. And ketosis is important. I actually don't think it's the most important aspect of water fasting, but it is a piece of it. And that is where when you stop eating, your body has to go to other sources of fuel so that you can survive. And the preferred fuel source after the glucose and glycogen, which are basically stored glucose in the body, is going to be going towards more fat cells. So when fat is utilized and it's broken down, we can actually sustain on it. Most of the cells can sustain on it. There's a few cells, like the red blood cells, that can't use ketones, so it's going to use mostly still the glucose. But these ketones can actually help us survive. The other benefit of ketosis, though, is, remember, most toxins have lipophilic kind of properties to them. So they will bind to fat cells. And we do know that. And there's actually some microtoxins as well that will be held in those fat cells. This is why, and I'm sure you probably talked about this, this is why sometimes with people, it's really hard for them to lose weight because they do have toxicity, they do have microtoxins, they do have these other really chronic, like deep-rooted causes that's causing them not to be able to lose weight. It doesn't have anything to do with like their diets or quote unquote how much they can exercise. And so when we fast, we actually allow all that fat to break apart, and then those toxins can come out into the system and the body can actually get rid of them. The second piece is something called autophagy. And autophagy is, I always call it like it's a beautiful cellular cleansing that happens. So we are always cleansing. It's sometimes I hear, oh, you go into a fast to detoxify. it's kind of true, but we're always detoxifying. Like our body has to always detoxify. What we actually do though is we ramp up or we upregulate those detox pathways, not only in our liver's ability to detoxify, but also on the cellular component. So I give this analogy is like, imagine if there was 20 people in the room and you're trying to clean. You'd get a pretty good job doing that, but if you kick everybody out of the room and then you clean, oh my gosh, you'd have so much more ability to do a better job. That's fasting. I mean, fasting is literally, let's get all the, kind of crap out of the Western diet. I just read the statistic, which is crazy. 60% of the diet in America is actually processed food, which I couldn't even believe that was a statistic, but it's actually a true one. And so we're getting all of that out. We're resting the digestive system. And so we're allowing those cells to do their job, which is like clean house. When those cells are quote unquote cleaner, or we're getting rid of the debris that doesn't belong there, or we're getting rid of old cells that don't serve the purpose anymore in the body, our body works better. Those cells work better. They have better reception for other molecules. So that's autophagy. And then finally, people don't talk about this enough, but the hormetic effect is probably, when I look at the physiology or the science behind it, that is probably one of the most powerful things about it. And that is the concept of when you apply a stressor to the body and the body can match it, the body walks and dances almost like on a tightrope, where it says, is this stressor something that I can kind of, match or even become stronger because of it? Exercise does this. Cold therapy does this. Sauna does this. This is why we're talking about it, because there's so much beautiful genetic modification that happens on the cellular level that then helps the organism move forward, the organism being the human body, right? Like move forward. So those are the physiological shifts that happen in a fast that I feel like are super, super powerful.
Amazing. And how long does it typically take with strictly prolonged water fasting? How long does it take to reach ketosis in an individual, as well as that autophagy effect, out of curiosity?
Yeah, so autophagy is usually in a couple days. So like you can reach that full level of that cellular cleansing. The ketosis, believe it or not, when you look at physiology, I mean, the reason why intermittent fasting is so kind of the rage these days, or becoming really mainstream, is that when you fast overnight, around hour 12, and remember, everybody is a little bit different in terms of how fast they can get into these different states, but because we're just, the body is so complex and so beautiful like that. But around hour 12, this is where we start to signal and say, hey, we're not getting any glucose. Like, can we start kind of really mobilizing other fuel sources? So that's where it starts to ramp up. You are probably in the max amount of ketosis in around day 3 of fasting. So, truthfully, like people ask all the time, like, are you guys doing like ketone sticks and things of that nature? Ketone sticks are truly made usually for people who are more intermittent fasting, like they're doing like, let's say 12-hour, 1 day, 2 days, something like that. Once you get past 3 days, the ketone sticks really are not as important, because of the fact that like you're already in the max amount of use of ketones at that point in time. So
And with ketosis, since we're talking about it right now, I'm just going to dive right into it. I know this question comes up a lot. This is a reason why a lot of people are doing ketogenic diets, right? Is to tap into that ketogenic state. But with prolonged water fasting, or with even intermittent fasting, like you're mentioning, we can kind of tap into it in that sense as well. So can you discuss your thoughts on a ketogenic diet, and then I guess maybe even compare it to why you think that, I'm assuming, that doing water fasting or fasting of any sort will probably be a better option in terms of hitting that ketogenic state?
Yeah, sure. So as I mentioned, ketosis is massively beneficial, but it's beneficial also because of the fact that you're using your own, right, fat stores to break down in in an environment, right, that you are resting your digestive system. You're not adding in any other toxins. You're actually getting rid of toxins that are stored in your body. And I truly believe this, and I am so willing to do a study on this if anybody is willing to out there. There is a nugget of truth in every single diet, meaning most people, once they give rid of the 60% of processed foods that people are eating, and this is the one thing that I think every diet book has, right? Get rid of the processed food, get rid of the artificial sugars, get rid of everything, eat whole foods. If you do that one thing, you're going to lose weight. You're totally going to lose weight. I mean, it's a common, I think, law that you're going to lose weight. So I think the rage with ketogenic diets, and in some cases, there are, you can even do vegan keto. There are some, seizure disorders where we have seen actually proof that they can be very beneficial. But you're doing a couple things. Number one is you're adding in food, so your digestive system actually a lot of times has to be ramped up even more so to process that food. Number one. Number two is all that food in this day and age, in where we are in the world today, there's over 25 pesticides that have been banned in over 30 countries. We are still using them in the United States today. The reason I say that is because it's almost impossible to not eat something that has some residue of that, and you're taking that into your body where you are then having to process that, and your body is having to store that, right? Yes, when you take in fat, right, there is a kind of an energetic expenditure that goes into processing that. But over time, when you look at longitudinal studies, or when you look at studies looking at it long term, you are going to see people that have increased cholesterol, they have increased heart disease, they have increased diabetes, because what you're doing is you're introducing more and more and more fat into the system. It's yes, you could be getting into ketosis because you're overloading fats, so your body's using some of that fat. But in the long run, you're actually putting more stress on the body, and you're building basically reserves at some point in time. It's for everybody, it's going to be a little bit different. I have patients that are like, oh, I did it for 5 years and I was really, great. Then all of a sudden my cholesterol started to bump up. So sometimes it doesn't happen right away, but over time it absolutely can be definitely, I think, more harm than good for sure. And it's super hard for people to do, I think, ketogenics in a way that I think originally was maybe what was designed. Most people are going to go off the rails and be eating bacon or, like meats. And the one thing I will say too is the one thing I hear all the time is, Dr. Veress, but I do grass-fed everything, across the board. It's the best. And unfortunately, runoff, that cow is eating like the grass that could have pesticides on it, that's potentiating in its body, that you're eating as well. And then there's still the cardiovascular aspect to it. So I'm not a big component of the ketogenic diet. So yeah.
I love it. So to summarize, what you're saying is here's the thing, is that when it comes to a ketogenic diet, a lot of people are starting to kind of tap into a lot of these really high fat animal product foods, and those foods are bioaccumulating over their lifespan,
Exactly.
right? These lipophilic toxins, which like to attract to fat,
Totally.
and they're storing in that. So people are trying to get into this ketosis state, but then they're also just accumulating themselves more of these toxins that these animal products have accumulated over the course of their lifespan.
Exactly.
So it's kind of like here we are, where are we seeing more benefits really there, right? Because it's just kind of like, it doesn't seem like seems like everything's just kind of hitting a plateau at that sense if you're trying to get into that ketosis state, but then inputting toxins as well. So I love that you touched on that. And the other piece that I love that you have mentioned a couple of times is, because when it comes to prolonged water fasting, it's the complete abstinence of any food, any calories, anything that you're putting into your system. And so when I worked at TrueNorth, there was one thing that Dr. Goldhammer had mentioned to, and I think it was in a lecture that really stuck with me, but it was that 80% of our energy goes towards digesting food. And so here's the thing with water fasting is that it's getting you to completely shut off that mechanism of having to use all this energy towards just digesting food, digesting whatever the heck is in that food, and allowing 80% of that body's energy to go towards actually healing. So we're getting so many more. I mean, you talked all about the different physiologic benefits in terms of not even just ketosis, but we're seeing so many other benefits in terms of just being able to completely abstain from anything that we're inputting and just rest and heal, right?
Totally.
Seems to be the
Absolutely. And I don't, it's not talked about enough, but that is a major reason why fasting in a relaxed state, in a parasympathetic, like really rest and digest kind of state, that we talk about, it's probably one of the most important parts of fasting for sure. Yeah.
And another thing that you've been bringing up too that I love is, sadly, we live in an overly polluted world. There's a lot more toxins that we're coming into contact with, whether it is the pesticides that you mentioned, or whether it's, in the shampoo that we're using, or the hairspray we're using, or the makeup we're using. It's just they're everywhere. It's hard to avoid now. And a lot of these toxins, like you've mentioned, are lipophilic, so they're really attracted to storing within our fat, and that's a lot of the times why people have issues probably losing weight. And so when it comes to prolonged water fasting, does it typically target that visceral adipose tissue, or what about that subcutaneous fat as well? So where are we seeing some of the weight loss occur from?
Yeah, great question. So we did a study, and we did try to nail down like where exactly does the body prefer to lose weight on a water only fast. And the good news is that it goes back to the body is so brilliant. I mean, the body absolutely knows how to heal if you give it the opportunity to do so. And across the board with every single participant, the body went first to the visceral fat. And that makes sense. If you think about it, your body's going to say, how do I heal at the fastest level for this organism, right? And it's going to go to that visceral fat because it is more inflammatory. There will always be, and it's a protective mechanism, that subcutaneous fat is actually very protective in a lot of ways, in obviously minimal, moderate amounts. And so there are times where you'll see people that are on the lower end of BMI and they are very, very lean, but they'll even have like a little bit of, subcutaneous fat. And that's not necessarily like what we're worried about, more so than obviously getting underneath that visceral fat that can really be so inflammatory and be a positive kind of move forward in their healing journey to get rid of.
Very cool to hear about that study. So are there certain conditions that you've seen in because you've been working at TrueNorth now for about a decade, right? So in your experience, are there certain conditions that you've seen respond best to water fasting? And if so, what is kind of the time frame that you typically see some of these conditions maybe resolve or respond best to?
Oh gosh, it's such a hard question because I'll say it this way. When metabolic conditions respond probably the best to water fasting, and that makes sense because most of them are due to dietary excess. And so it makes sense in terms of, it's obvious that if you actually reduce that dietary excess, then you'll have benefits. So typically, anything in that realm, like, so we're talking about diabetes, high cholesterol, we're talking about that abdominal, visceral fat accumulation, high blood pressure, anything in that realm. On average, we see 14 days as moving the needle towards them getting resolution of that. Of course, everybody's going to be a little bit different. So there are some people that are going to need more time. There are some people that within 3 days, because they're salt sensitive, their blood pressure goes back to normal. And, but 14 days. The reason why the question is hard is because I will say that in the last 5 years, we have seen such an upsurge of individuals that have autoimmune or cancers, even like follicular lymphomas. And we have been seeing really like truly amazing results. I just had a patient and she had high ANAs, a diagnosis of lupus for years. And she, this year, because of her fasting, because of a lot of things that she was doing with optimizing her health, her ANAs are negative. And she even we did a test, and I said, go back and just test at home to use the same, laboratory you used there. Came back ANA negative. And she does feel, the reason we tested is because her symptoms were totally resolved as well. So the reason it's hard is because I have a feeling that since we're seeing more and more cases, we're actually probably going to see that not only just metabolic conditions are going to be healed through this, but a lot more, out of the box, like autoimmune cancer. And even we've been seeing a little bit more of like mast cell activation. We've been definitely seeing a lot more like SIBO cases, just because it's unfortunately kind of on the rise as well in the world.
Wow, that's amazing. It's just incredible to see that once you start to tap into those innate healing mechanisms, when you're getting rid of just everything, toxins and foods and all those kinds of things, that the body can just reduce and just drive down that inflammatory response, which you saw in those patients' ANA markers, which is so incredible.
It is. It really is.
No, so what's the typical amount of time, or what's the lowest to the highest amount of days that you guys are typically water fasting at TrueNorth?
So we typically will water fast 3 days, which, is in some texts, or, according to us, like probably the start of a prolonged fast, up to 40 days. So we don't go past 40 days. Technically, if you look at like literature, people have fasted past 40 days, but after that, it does become much, much more riskier. And we have had just, case study after case study after case study of people doing a really great 40-day fast, if it's indicated and if it's safe for that person. So 3 to 40 days.
And during this time, you had mentioned earlier, complete rest, absolute in a resting state during water fasting, meaning trying to not let the outside world stressors get to you, try not to work, try to do what you can to just promote that resting, right? So what are some of the recommendations that you guys are usually making during this time, especially somebody that's doing such a prolonged water fast? Because you probably don't want them walking around too much or exercising too much, things like that, correct? It's pretty much just resting as much as you can.
Yeah, so there's a couple things. One is we have 2 lectures at TrueNorth that usually happen during the day. So it's a 10 and 2. And so those we try to just produce education so that people can have a really good way of exiting the water fast into the real world. And we also at TrueNorth do nutrition-based medicine, meaning we do educate on the power of whole food, plant-based as well. And we have a little bit of an added spin to it where we try to really get people into no salt, no sugar, no oil. And then what we recommend is, trying to stay out of the sun. You can go out in the sun for 10 to 15 minutes, but that can even be a little bit too much stress on the body. Walking just really a limited amount, because you do want to move circulation. You do want to move your lymphatic system, but you don't want to overstress the body, because like I said, you're going to heal at a deeper level when you rest, but also we want to preserve muscle mass. So one of I think the fallacies is like, oh, if I fast, I'm just going to lose so much muscle. And that's actually not a true statement. When we did these studies, while we were looking at visceral fat and whether or not it's a preferred fuel source, and it is, we were also looking at how much muscle does a person lose, or can they actually conserve that? And we do. So if you rest, then you will conserve muscle loss. There's always going to be a little bit of it, but you do conserve that. So that's one of the other reasons why we don't want people walking too much. And also, when you have lower calories, it does set people up for more risky, type of like lightheadedness, things of that nature. So yeah.
And you mentioned earlier about in the last 5 years, kind of seeing an increase in autoimmune conditions, different types of cancers that you guys are starting to now see these patients at TrueNorth Health Center. And so within these last 5 years, we all know about the COVID pandemic, and curious about any patients that came in with long haul COVID symptoms, loss of taste, smell, things like that. And curious if you saw resolution in some of those symptoms and chronic fatigue as well from COVID.
Yes. We've seen actually both things. We've seen long haul COVID, and we've also seen individuals that have really adverse reactions post vaccination as well. So we've seen actually like both types of cases, and we have gotten amazing benefits from it. And I will say, there are a few cases where we've seen shorter fasts be really beneficial. So what I mean by that is, say, like anywhere from 5 to 10 days, but we've had 21 to 30-day water fasts where people have almost resolved their entire long COVID type of symptom profile. So fatigue, regain in taste and smell, the numbness, tingling some people felt. We've even seen lab results where people had very distinct increase in inflammatory cytokine markers that were recorded. They've seen those become benefited by the fast. So yeah, we've actually had some really good results with it.
Amazing. That was going to be my next question, was I guess the amount of time typically, but again, like you mentioned earlier, every person is different individually. Everybody. And so, yeah, so it's going to depend on the individual, right? So, so you mentioned SIBO, small intestinal bacteria overgrowth, and that you guys have been seeing more cases of this as well. And for the listeners, small intestinal bacteria overgrowth is exactly as it sounds. It's just an accumulation of bacteria that's overgrown in a place it shouldn't be within the small intestine, which can produce bloating, gas, abdominal pain, constipation, diarrhea, depending on the type that you have. So this was going to be one of my questions, and I'm so excited you brought up SIBO, is benefits of fasting with the gut. So what are some of the mechanisms you believe that are probably helping to support the gut microbiome when it comes to fasting? And if you're seeing resolution too with chronic digestive symptoms at TrueNorth?
So short answer is yes, absolutely. We're seeing massive benefits with that. Longer answer is the fact that it can be complex. And if anybody's ever dealt with, small intestinal bacteria overgrowth, or even been diagnosed with like increased intestinal permeability, which is kind of also called leaky gut, I think fasting can be a very important part of a treatment protocol or recommendation. Sometimes is not the end all be all of it, but with fasting, one of the things which is really positive is, again, you stop the influx of inflammatory foods that usually are causing some of this to occur, or some of the damage to actually take place. So that's positive. The downwind is also a lot of individuals that have had chronic digestive issues are on many medications that are increasing the damage at the gut level without knowing about it, because they've just been put on proton pump inhibitors, or which are usually given to people who have acid reflux or gastritis or things of that nature, or they're taking a lot of NSAIDs because of the fact that they have abdominal pain, or they have some of these different symptoms that they're trying to either self-medicate, or their doctors might not know maybe the root cause, and so they're putting them on that. And when you go into a water fast, like I said, you're going into this digestive rest. So number one, that gives your body the ability to use that energy to heal at the level of the gut. And in addition, you're not putting in any of these potentially inflammatory type of products into your digestive system. more so than that, what we're looking at, especially with the microbiome research, is that one of the best ways, not the only, but one of the best ways that you can increase diversity in a gut is through fasting. And so fasting naturally has this amazing ability to help us improve something called our commensal or good bacterial group. And I always call these our neighborhood because, if you think about your neighborhood, you want people in your neighborhood that, it's like this beautiful interaction where I'll take out, I'll grab your mail, you grab my mail, I'll take out your garbage, you take out my garbage. It's this beautiful interaction with other people. Well, that's your commensal bacterial group in your microbiome. These are like trillions and trillions of microbes that live amongst us, within us, and they help us, right? It's a symbiotic relationship. So it's beautiful what fasting can do because it can help bring up those helpers. And then the majority of the microbiome is what I call opportunistic, because not what I call, sorry, this is in the research, but so it's opportunistic, and it's because they can play nice, and they usually are playing nice. They're there because they're part of your biodiversity. We don't want to get rid of them. It's just that they're fantastic. But if you piss them off or they get pissed off, they're going to piss your body off because they have this communicative ability with every single cell in your body. So if they're pissed, they're going to be sending pro-inflammation into the system. The system is going to become even more inflamed. And so there goes that cycle. With fasting, we actually start to calm down that opportunistic bacterial group, and we bring them back into more of a anti-inflammatory type of component. So fasting has all these different pieces to it that we are now understanding that can actually help with digestive disorders. And in addition, I will say that in treating people or helping people with SIBO, with a fast and without a fast, I do see people can improve maybe faster. Not that they need fasting necessarily, but I see that there's an improvement a little bit faster with their symptoms. And sometimes that relapse that can happen doesn't happen because you're already setting a really good foundational point approach. Not everybody can fast, as just an FYI. So that's also something you just need to talk to your doctor about. But if that is a possibility, we have seen some good results with it.
Amazing. You have such a beautiful way of describing things in our gut microbiome, and it just sounds so lovely. Our bodies are so beautiful. And that's what I love that you keep coming back to, is how our body, it has the blueprint to heal. That's what you keep driving. That's the point that I see you keep driving home and that you so firmly believe in. And that's something I also try to tell each of my clients, is that the symptoms that you are experiencing, it's a protective mechanism of your body trying to show, okay, like there's something wrong. It's not that our bodies hate us or that our bodies are like, I feel like just making her have a bad day today. It's that it's trying to communicate with you and trying to let you know there's something that needs addressing. And the thing with fasting, is that it's so healing at the cellular level. It's supporting all those beautiful things that you keep mentioning and just like enriching those and then allowing the body to just tap into that healing mechanism. So I think that's great that you keep bringing that up.
And this is why the work you're doing, or the work that, TrueNorth is doing, is so important, is because I do feel that way. I feel like in every situation in our lives, when we see the check engine light go on, we go and we say, let's go to the root cause of it. There's never a time where you will actually look at your dashboard and rip out, right, that check engine light being like, it's going off, I'm just going to rip that thing out, right? No, you go to the root cause. In health, that's the only time somebody will say to you, oh, you have high blood pressure. Let's just give you drugs for that symptom, instead of saying, well, why is it that you have high blood pressure? Are you eating too much salt? Are you not moving your body? Do you have too much stress? Are you drinking too much alcohol? I mean, and that's why what you're doing is so important, or why really opening up people's minds to this concept that the body does have a blueprint. It's just right now we're standing in our own body's way, and to help facilitate that healing process. Yeah.
Yes, absolutely. So going back to SIBO, something that I have noticed, especially with just chronic digestive symptoms in general, is a nervous system component to it. And that, like you had mentioned that in terms of like SIBO, that you see that fasting can help with some relapse rates, because we know that 2/3 of patients with SIBO end up relapsing. And I believe that there seems to be, and I've been noticing this too with some of the people I've been interviewing, and there's a little bit of consensus about this with the nervous system involvement in just everything. And especially when it comes to digestive symptoms, and that if we are in this heightened state all the time, which it's normal to be, because, well, sad to say that it's normal to be, it's just our, what, dealing with societal stressors nowadays with, having to get up early, go to work, pack your kids' lunches, you don't barely have time to ourselves. But I see that stress seems to be something that turns off something called our migrating motor complex, which is just, it deactivates it basically, which is our gut's like street sweeper. It just helps us sweep toxins and all these accumulation of things that we don't want in our small intestine out, so that it can get out, digested out of our system, and our bodies can just relax and heal. And when it comes to fasting, this is kind of this is where I'm bringing the nervous system component in, and I'm kind of making this link here, is that you keep mentioning resting in that fasting state. And that's, again, 80% of our body's energy goes towards digesting foods. But when we're fasting, we are trying to tap into that resting state. Just like you mentioned, very little movement, just to make sure that you're moving your lymphatics, getting out and about, but you're really just resting. And that, in a sense, is healing the nervous system too. That's allowing your body, your digestive system to rest. And I can see why you're probably seeing improvements in those relapse rates with SIBO and probably other digestive conditions as well, because you're really just, one, abstaining from anything that's incoming, but two, your body's just finally resting and getting into that rested state, right?
For sure. I always think of it as two different, I always kind of bring out two different points. One is, one of the major aspects, not only just in SIBO and other things, is that we get into this inflammatory response in the body. And so, and part of that response system is something called the vagal nerve, because that's a huge connection between brain and gut, and the entire nervous system as well. And many people probably heard of somewhere along the way, is like, you have a huge enteric nervous system right in your gut, like right there. So it's a very important aspect of so many different kind of nervous system sequelae of a lot of these that start in the digestive system. But also, fasting is sometimes the treatment, or rest is the treatment, to start to kind of balance the migrating motor complex as well. So, like, you're right. So it's like fasting along with rest can be so powerful in not only just kind of like the elimination, but also the nervous system reset. So yeah.
And kind of going off that, just on the topic of the nervous system. So we know a lot of adverse childhood events, ACEs, or trauma, or things that occurred along our life can show up physically at some point as a symptom in our body as well. And so with fasting, I remember seeing this when I was at TrueNorth Health Center, was sort of a lot of emotional releases that were occurring throughout that, which was such a beautiful thing to see, like somebody finally being able to sort of release that, and then physical symptoms start to really resolve. And so do you see that quite a bit as well, like with in your history of working at TrueNorth Health Center, with just spiritually, nervous system, healing from trauma, things like that showing up during fasting?
Absolutely. I think just like what we were talking about with the fat, as you're breaking that apart on a physical level, it releasing, ionic charges with certain types of toxins. I also think that the body organizes trauma in the system, and we know this through somatic work or EMDR. Like, we do know the body holds on to stress or trauma in different ways. When you allow the body and you kind of get out of its way, it's going to start to organize and be able to have that space to release it. Because a lot of times what do we do in our life, right? We have something and we're not dealing with it. We actually stuff it down and we go on and we work and we work and we work and we we try to like push through it without really understanding that what we're actually doing is we're kind of storing it. And when it stores, it's kind of like that glass filling until it overflows. So we do see actually quite a bit of trauma being worked through or released. The other cool thing, and I'm just going to throw this in there because this is where microbiome research is going, is the fact that we now are understanding that with individuals, if we can actually help reshape their microbiome in very specific ways, we're seeing people have so much improvement with anxiety, depression. There is actually studies being done now on microbiome and post-traumatic stress disorders where just changes in the microbiome can actually help someone heal through post-traumatic stress disorder faster and potentially like in a way that's a little bit more supportive than just with cognitive behavioral therapy and all the other things that we use with post-traumatic stress disorders. So it's exciting. And as I mentioned, one of the greater ways to kind of start to reshape the microbiome is actually through fasting. So
that's so exciting to hear. Oh my goodness. Yeah. So one thing that you had mentioned earlier that I really wanted to touch on as well was, like you had mentioned with, when it comes to even SIBO or mycotoxins or things like that, we're inputting supplements to help either kill off things or to bind things and get them out of the system. Like, for example, toxin removal, like with mold, things like that. And so, I had Dr. Todd Medeiros on the podcast recently, and he works with a lot of complex chronic illness patients. And I loved what we touched on towards the end of the podcast, and this is why I'm bringing it up, is because you mentioned it, is how fasting is just really getting to that cellular cleanup help, right? It could be that last addition that your body kind of needs to start to repair the damage that had been done through years of toxin exposure, through years, even using supplements constantly, right, to kill things off. That is a stressor to our system as well sometimes. So I could see how with fasting, it's such a great adjunct to some treatment plans when after you've done, whether it's a killing phase for SIBO or whether it's, detoxification of mycotoxins, things like that, to help really heal at the cellular level.
And I will say, just on what you just brought up, is that in some cases, it's actually not the best to fast first. So I think a lot of people think, oh my gosh, I'm so full of toxins, or I know I have all these microtoxins. And the first thing they think of, I'm just going to go do a fast. We are getting into a place where I feel like in some cases, we actually are almost too toxic in some individuals, or there's too much inflammation that fasting might not be the first thing that I would even prescribe to that person. And I love the way you brought that up, where it could be a part of the overall treatment protocol. And I've seen many people who have had, like, let's say we know they have toxins, or know they have SIBO, or know that they have microtoxins, and they've done beautifully. But a lot of times, interestingly enough, it is like actually after we've dealt with some things that will allow the body to go into a fast and heal. Because the one thing I keep wanting to come back to, and this is why I think the hormesis aspect is so important and why the rest is so important. I have seen many people fast on their own, and they do not get the benefits that they get when you come to TrueNorth. TrueNorth, you're supported by a medical staff and you're medically supervised, and we check on you multiple times. You have access to us 24/7. There is something about that creates even more of a parasympathetic, restful state that allows people to go into a depth of healing, but also I will say that not only that, it allows for that cellular depth to happen, where I think just when people fast, they might not get there because there's all these stressors of like, oh my gosh, I have cardiac awareness. Is this dangerous? Or I have this, which is, is this dangerous? Going back to that piece too, is the fact that fasting works because that rest and fasting allows the body to match it. And like I said, it's a dance. If there is ever a place where the body's like, I can't handle this fast, like this stressor of fasting because I'm too overloaded or I'm too stressed or that, then there is this kind of concept of like, is that going to be more harm than good for our body? So, yeah.
Thank you for explaining that. That was really helpful. Because I do believe too that sometimes, and I know that you guys do this with, the diet piece and the resting piece. And, when your lectures, what you guys are discussing with your patients there is that getting to the basics is super important too, right? So maybe before someone's coming in, I know that there's protocols you guys have in place. Well, before you're even fasting, we want you to be eating whole food, even if it's not your normal diet. We want you eating whole food, plant-based, for a few days, right, before you come in, because that helps to ease into the fasting process as well, correct? Because you're really starting to help get in that fiber, get things moving, get your bowels moving, get toxin removal, correct?
Yeah, exactly. Yeah. And there are people, just to add to that, there are people where, they can't fast right away. We sometimes have to say, like, I want you eating for a week. I want you actually trying juice cleansing for a week. Let's start there, because people sometimes when they go to whole food plant-based, no salt, no sugar, no oil, they will start to ramp up so much detox that they're miserable. They have headaches. They're vomiting. I mean, and this is just dietary shifts. Like, I mean, this is not even going into a water fast. So yeah, absolutely.
It's amazing when you start to just decrease the input of toxins or the input of stressors to your system, whatever it's in turn of, and how that can start to ramp up your body's detox mechanisms. Like, so diet alone can do a whole lot.
Whole lot.
Yeah. So one thing I wanted to ask you was then the different types of fasting. So there's intermittent fasting, like you kind of already touched on. There's different forms of it, whether it's 16 hours, 16/8, or whether it's even doing a full 24-hour water fast once a week, or even the prolonged 5-day fasting mimicking diet. So curious your thoughts on each of these as like an adjunct or to for someone utilizing them at home, because if someone's just not going to be able to come to TrueNorth and do like a full on like water fast, if this is something they want to just maybe start as like kind of prepping with some fasting before they head over to TrueNorth to do more of a prolonged water fast.
Yeah. I would say, so I always think of prolong as like the gateway drug into fasting, like this. I always say if you've never fasted or you've never even heard of fasting, it's a beautiful way to just kind of start to experience it. It does have a lot of known benefits, just even, and Walter Longo's work, who kind of designed this prolong, I think his work is so brilliant because he is the person that, while we do it on a clinical level, he's doing it in a research way of understanding on the cellular level what's going on. And I mean, it's so powerful in terms of you're already seeing reduction in, CRP, which is C-reactive protein, which is an inflammation marker. I mean, you're seeing already, like brain-derived neurotropic factor, which is actually like fertilizer. So we're seeing hippocampal regrowth, neuronal regrowth. Like we're seeing, changes in stem cell production. I mean, there's a lot already we're seeing just if you take 5 days and you do a reduced caloric load. So his program uses around 700 to 800 calories after day one for the rest of the 4 days. It's a 5-day program. So I love that. And like I said, I think it's a gateway drug. So I think if you've never tried it before and you want to just do something that's really simple, that's a box and you get it and you just follow the instructions, I think that's awesome. I do think that if you want to go deeper or you want to kind of explore other things, there is a way that intermittent fasting can come into play. I don't love 24-hour fast only because I think if you're going to do 24 hours and you are safe to do something a little bit longer, 3 days is where you start to get into so much of the healing benefits. And again, I keep stressing this, but not everybody's safe to fast. If you're on any sort of, medications, it might not be the best thing for you as well at that stage, where juice cleansing or maybe just changing your diet could be better. But I think that is where the power of those intermittent fasts can happen. And I do, depending upon a person's health profile, I will recommend it maybe once a month, maybe even once a quarter. I do at this point in time, after 10 years and seeing like what the world is kind of shifting to, I do think people should do a cleanse at least once a year. I absolutely feel that way. Some people might need two, some people might need a little bit more depending upon what they're dealing with. I definitely like full stop think that everybody should do a 12-hour fast every single day. So that just means from dinner to breakfast, 12 hours, do not eat anything, give your body a rest, that water, just obviously drink water or you're sleeping at that point in time. But in some individuals, I'm even pushing that to potentially 14-hour fast. Sometimes there's even a 16-hour. I don't love one meal a day fast. I think that if you are maybe a monk or somebody that's meditating, 12 hours a day and then that's your meal, then it's arguably, better for you. But it's very, very, very difficult to get all your calories in one meal. And also, I think what happens is people tend to overstuff themselves and eat, and I don't think it's really healthy for your digestive system. But 2 meals a day, if somebody's really trying hard to get all their macro and micronutrients in there, I think you can definitely do that. So that's how I kind of think about it. It really depends on, are we dealing with chronic illness? Are we just doing a preventative approach? So.
Oh, that's great.
Yeah.
And when it comes to the refeeding process, so this is something that, working at TrueNorth, it was just as important, that I remember being just as important as the fasting itself. And this is why medically supervised water fasting is very important, because there's a lot more that goes into it besides just abstaining from food. And so can you discuss the refeeding protocol and why you guys focus so much on a whole food plant-based diet as refeeding, but not even refeeding? It's what you're educating your patients on to promote to do long-term for the rest of their life. So hopefully they don't have to come back and do a 30-40 day water fast to help resolve whatever condition they came to TrueNorth for in the first place.
Absolutely. So refeeding syndrome is a true thing in the world. So what that is that basically you go through physiological shifts, changes, and most of it is like an electrolyte kind of cascade that happens due to insulin being overshot when you eat too high caloric density foods right after a water fast. We see this in the world when people do not understand water fasting whatsoever. And this goes back to that ketosis concept where everybody's like, well, I'm in ketosis with fasting, so what I'm going to do is I'm going to eat a big steak the day out of a fast just to keep that ketosis going, and that will land you in a hospital with refeeding syndrome. So it is absolutely very different. So what we recommend is that, and what we have seen, and this is not just in the 50 years that Dr. Goldhammer's been doing this. I mean, fasting goes way, way back, where we've understood that when you are in a fast, because you're, dropping down and you're down regulating digestion to let it heal, you have to slowly reinvigorate digestive enzymes, get that migrating motor complex going again, get the peristalsis going. I mean, all of that stuff. You start with the easiest food to digest, and that's usually something that's liquid. So that's why we do green juices, or mostly green juices to start. These are not like pure fruit. They can have fruit in them, but it's mostly like vegetables. That slowly, without fiber, gets that digestive system going. We move into, depending upon what a person's needs are, we can move into raw, or we can move into raw vegetables, or we can move into steamed vegetables. Then we move into additional caloric or higher caloric density foods like potatoes or sweet potatoes, things of that nature, squashes. Then we move into higher caloric density foods like beans and grains. And then finally, the last thing is nuts and seeds, because they take a lot more energy in order to process and to digest. So usually that's our refeeding program. It's super slow. It's very much designed based upon how long a person fasted for. So as you can imagine, if somebody's fasting for 7 days, they can probably do that refeeding program like very gently within like a 3 to 5 days period of time. If somebody's doing 40 days, we extend that and we do more time getting a person really refed in an appropriate way so that they don't have refeeding syndrome. And also, one of the big things that I try to teach people is that you have just done an amazing healing with your body. So many people will also say, like, I got this, I got the diet, I'm just going to leave, I'm just going to go back into the real world. Well, I feel like it's kind of like a convalescent phase. It's like if you just had COVID and you know that you're like one day out from being the sickest you've ever been in your life, would you ever go out there in the world and just say, all right, that's it, let's party, I'm gonna go back to work, I'm gonna go back drinking, I'm gonna do all. Most likely you're not. You're gonna be like, I'm gonna give myself a couple of days to just kind of reorganize and get back into the world. The same thing, similar, is in fasting. Is like you've just done a major healing protocol where your body is like, in a deep state of rest. It takes time for the body to come back into its normal physiological state. And when you give it the ability to do that in a restful state, in a very, kind of supportive state, you have so much more benefit after the fast, after you're, out of True North or you've done it, appropriately. We also recommend whole food plant-based because that is, number one, the best way you're going to increase diversity in your microbiome. And we know in microbiome research, diversity equals optimal health, or it moves you towards optimal health. We also know that, when you're eating whole food plant-based, you're getting, like, every bite, you're getting a chock full of phytonutrients, antioxidants, you're getting high fiber, which is really fantastic, not only for your microbiome, but for every cell in your body because of the short chain fatty acids that it's producing. I mean, I can go on and on. And when you also look at like blue zones, right, we know that the healthiest diet out there is something that is at least 90 to 95% whole food plant-based, because that is what we're seeing people living into their hundreds, across the world. So, and it's also one of the most cleansing diets, right? Like you don't have that potentiation of toxins. You can, wash your produce and really try to get off the residue. You can really practice, organic versus non-organic type of produce selection. So that's why we also promote it.
Yes. Such a big proponent of a whole food plant-based diet for so many reasons, through research, through fiber, through the longevity studies that we're seeing with blue zones. I mean, it's just fantastic. And I love that it's not just to come to the center just to fast, but it's to what are the habits and, food choices you're going to make afterwards, which is so important. And, I know at TrueNorth Health Center, so there's 3 meals that are cooked every day, breakfast, lunch, and dinner. There's fresh fruits and nuts and things like that as like snacks for people. And so people can even go to the center just to eat. And a lot of people do. They go just to get away from the stressors of life and the just the things that are very tempting out in the world, right? And just to be able to go there and eat. So one of my last questions for you is about juice fasting as well. So we know that obviously eating high fiber foods, vegetables, fruits, all of that is going to be so beneficial for our detoxification systems. But you mentioned that in some cases, or in quite a few cases, a lot of people aren't going to be able to fast. And so you might just start them on the whole food plant-based or also juice fasting. So in terms of just kind of getting in that cleanse, like you mentioned, once a year, would you qualify juice fasting as also something that would be good to do if someone is just unable to maybe do like a water fast?
To be honest with you, I actually love juice cleansing in some situations even better than water fasting. So so short answer is absolutely and yes. And the reason why is because the way I look at it, and when you look at the research going back to even Walter Longo's work that he's doing, you are getting a glass full of antioxidants, phytonutrients. I mean, there's so much going on in that beautiful glass of juice that you're taking in. In addition to it, because you're not getting the fiber, you do have a level of digestive rest that's going on in the body, because the body is definitely having to produce some digestive enzymes in order to process the juice, but you're not having that. And it goes back to, like, people always ask me, juice or smoothies, and it's like, it depends on what you're trying to do. They're both phenomenal, but they're going to do different things in terms of healing the body. And so with juices, you're doing a little bit of a digestive rest because there's no fiber in there. You're getting all these phytonutrients. You're actually activating or helping the liver detoxify. So I love it. And I think it's, as you mentioned, safer than water fasting if you're not sure if water fasting is safe for you at this point in time. And I think people can do it in the ease of their home a little bit easier than coming to, like, let's say, a center to be supervised. Again, though, there is even the cases where I don't know if I would, tell some people to juice cleanse unless they really check with their physician, because there are some people that are on, polypharmacy, lots of different medications. So you just have to, really understand it, because the power of it is that you get healthier. But if you're on some medications, you can actually cause more issues, because if you're on, let's say, antihypertensives and you're going on a juice cleanse, I've seen people within days have their blood pressure drop. So if you're on medication that's dropping your blood pressure and you're doing this wonderful thing for your body that's dropping it, some people can get themselves into trouble. So that's just an example of how, it's powerful. It's wonderful. I love it. It's just that you just have to definitely be careful with it. So
thank you for explaining that. So, So this was all such good information. And Dr. Csilla, you are seriously just an abundant ray of light. Like, you have so much beautiful knowledge and such a great way of explaining everything. And just, I know from when I worked there, every patient that ever worked with you raved about you. You are just so wonderful. So thank you for being a guest on the podcast. And I would just love to leave it to you to explain, like, how can people get started with working with you at TrueNorth, and what's the process, and where else can people find you to, get more information about all the great knowledge that you have to share with the world.
I loved being here, by the way. Thank you so much for having me on this podcast. I do have my website up. It's www.drchillaveress.com. That you can find my stress course, my ebook on intermittent fasting. I also do take patients in my private practice there. I do work at TrueNorth, and I'm seeing patients as outpatients, meaning you don't have to come and stay at TrueNorth. And also, if you ever do come and water fast, you can always come see me as a supervising doctor there as well. That is just calling TrueNorth, finding us online. It's healthpromoting.com. I also do coaching along with them, so that's on their website. And then you can definitely find me on Facebook and Instagram, and that's Csilla Veress ND LAC. So.
Oh, great. I'll make sure to include all those links in the show notes. So thank you so much again for being a guest. And I cannot wait for this episode and for everyone to hear about it.
Thank you.